It is with the greatest pleasure I welcome Maria Taffe once again to the studio, our pharmacist extraordinaire, the lady who knows a lot about most things in relation to pharmaceutical disciplines and pursuits. Today we're talking a little bit about arthritis, Maria.
Yes, Rowan, I thought this would be an interesting topic due to the vast number of people within the UK that actually suffer from arthritis.
When you say a vast number, what are we talking about?
We're talking 10 million.
Wow.
It's the estimated number at the moment, 10 million people within the UK. So if you extrapolate that across the world, you get the idea that a lot of people are suffering from arthritis. So extremely common. There are two main types, as most people would already know. There are actually multiple types, but two main types make up quite a few of those numbers out of the 10 million. So you're talking osteoarthritis, the most common type. Joints,
yes.
Wear
and tear.
Yeah, so your osteoarthritis, 8 million people in the UK, extremely common. An extremely big issue that a lot of people have to deal with. It is treatable as such. It doesn't have to get worse. The condition can be kind of limited with good care. So when we talk about osteoarthritis, you are talking about wear and tear. It's your joints. Sometimes it's damage. Damage obviously increases over the years. The more damage you do as time passes. Sometimes it's related to weight. So your weight can be a big issue, how much pressure you're putting on your joints. And basically your joint is breaking down. So you're talking about the bone starting to wear against other bone. The joint itself breaking down, bone remodeling. It's a degenerative disease.
But it's not something that will kill us.
Oh, definitely. Well, we would hope not. No, definitely not. It should be treatable.
Yes.
So you're talking about good exercise regimes, stretching, muscle strengthening, making sure that you're not limiting your movement of your joint. As well as that losing weight, if it is weight that is exacerbating the condition.
What about rheumatoid arthritis? What is that about?
Rheumatoid arthritis, you could almost say, is completely different. It's a lot less common, so we're talking about maybe 500,000 people in the UK, slightly less than that. It actually affects more women than men on a 3-to-1 basis or thereabouts. And it is actually an autoimmune disease or process.
What does autoimmune mean?
So autoimmune means that your immune system actually gets a little bit confused. So the particles such as foreign particles such as bacteria, whenever you have an infection or that, your immune system should recognize it as a foreign body.
And attack it.
Yes, and
get rid of it.
Yes, exactly.
But in the autoimmune thing, it starts attacking the healthy tissue in the body.
Exactly.
Yeah.
So your own body attacks certain parts of your own body, which it shouldn't do. So usually this starts off with your synovial membrane, which is a nice smooth covering for your joint. So it starts chemical changes, you could say, within the joint. The synovial membrane becomes thicker. Parts of the bone might become rubbing against, the whole inflammation, everything like that.
And you say it's more found in women than men.
Yes, there shouldn't be really a cause. It's just
a reality.
The way it is, I suppose.
The way it is, some things are like that. So what can be done about those who suffer from arthritis? What can you do within the pharmacy?
Well, now, rheumatoid arthritis is actually quite different, as I said, to osteoarthritis.
Yes.
So with rheumatoid arthritis, the key is early diagnosis and early treatment. So you want to get in there as quickly as possible for the rheumatoid arthritis. Basically, you want to change the process of the disease, and usually this is done with medication. So medications are the way to go. with rheumatoid arthritis.
And that takes us into the territory of the GP.
Yes, all these medications, usually actually they're prescribed by specialist doctors. So if your GP is suspecting that you may be suffering from rheumatoid arthritis, you're usually referred to a specialist immediately, you could say immediately, to start treatment. So there's disease-modifying anti-rheumatic drugs, also known as DMARDs for short. You may have heard of the medication methotrexate.
Yes.
That can be used for quite a few autoimmune conditions, so that will be commonly used in the treatment of rheumatoid arthritis.
So if I've got something as ordinary as the arthritis, the osteoarthritis,
yes,
I come to you and you can do something for me.
Well, with any suspected arthritis, I actually, if the GP hasn't seen a patient yet, I actually would nearly prefer them to get checked out
first of all,
by their GP, because rheumatoid arthritis and osteoarthritis, there needs to be a distinction made between the two, simply because of their such different treatment paths. The treatment for rheumatoid arthritis is quite aggressive in stopping the disease. If the disease gets going and it's not treated, it can lead to complete joint breakdown. You know, your joint, the appearance of the joint can swollen, but it also can, you know, break down the joint so much that you can actually have, you may have seen people with maybe a finger pointing the opposite direction than it should be, and that can be quite often caused by rheumatoid arthritis that has not been treated.
Are you finding that folk are coming into you in your shop on Mulholland Street, McNally's, and are having this very conversation with you? What does it mean? What have I got? Yes,
certain patients, if they are concerned, you know, they even already have been to see their GP and they want a little more advice. Maybe they're unsure of what's going to happen with their treatment. So a lot of patients will come in. It's absolutely no problem for us to sit down and have a quick chat about, you know, what type of arthritis is it. We have a wealth of knowledge down in the pharmacy, so information is key for most diseases or ailments. You need to know what is going on for you yourself to be able to then combat the problem.
One of the things I would have used is, and I have a problem with it on my knee, I would have used a knee bandage, and I got that from you. That's a good idea?
Well, you use a compression bandage.
Ah, that's what it's called.
Yes,
yeah.
A compression
it's
bandage.
Like a little envelope that you pull up onto your knee, and it's elastic and stuff like that.
Some people do like the compression. They feel that it's an extra support. Usually, I assume you're suffering from osteoarthritis, so the wear and tear.
Wear and tear, that's what they said. They detected it in an X-ray.
Right.
So they said, yes, you've got the start of osteoarthritis.
Very good. For osteoarthritis now, we've talked about the rheumatoid arthritis and all the medications, but osteoarthritis is actually a completely different treatment path. It's it's more non-pharmacological. So you start with exercises, as we said. Yeah. Then if you do feel that the pain is too much, you can start on simple painkillers like paracetamol, NSAIDs, the non-steroidal anti-inflammatory. So you're talking ibuprofen, which is a household name. Those rubs, which you can actually rub into the area that's affected.
Are the rubs better than the medicine which you imbibe? The medicine you take, internally it spreads through the blood system, I suppose, into the region of need, whereas the other, you're rubbing it on and it's going in.
Sometimes I find this is an area of confusion. People think when they rub something on, it maybe just stays on the skin, but it actually does enter your system. When you rub an ibuprofen gel or any other of those types of medicated gels onto your skin, it actually enters into your blood supply. It is entering into your body. Although it may be more targeted, going directly into the tissues that need the treatment, it still does enter your system. I personally would not recommend using, say, an ibuprofen tablet along with an ibuprofen gel.
Oh no.
You're almost getting a double dose into your system. So if you find that the painkillers or treatments along that lines, you'd need to definitely get a checkup. It's, you know, when you're using two different groups of medications such as paracetamol and ibuprofen, they're completely different mechanisms of action. They work in a different manner within your body. They're excreted from your body in a different manner, and it's fine to mix that type of combination, your paracetamol and your ibuprofen, and hopefully that should control your pain. If you find that it's not, that will be at a stage where you need to get back in and have a chat with the GP to make sure that you know, things haven't changed in any way, to rule out other joint issues as well.
Are you busy down there?
Oh, we're very busy as usual, Rowan.
It's interesting because you're so very convenient there with the kiosk, and people are using it, and you deliver things home at night, because I was there recently with someone needed something, you didn't have it, but it would be there by 2 o'clock and it would be delivered out right to the doorstep.
Delivery service is absolutely no problem. We find now with back to school times there are quite a few different ailments reoccurring, such as head lice, thread worms, these common
transmissible things.
Very common.
The little creatures leapfrogging across from one child to another, dear bless them.
Yes, so we're open to 10 o'clock at night, so a lot of mothers and fathers do pop in for a little bit of advice in the evenings and weekends when the children arrive home from school and there's something they've picked up.
Oh God, yes indeed. Well listen, we wish you well. Thank you for coming in once again. And you keep you bugs and drugs, that's what you do down there. You look after us, and thank you very much indeed for so doing. Maria Taffe, thank you. Thank you, Maria.